You've built a successful life, but now what? Welcome to the Gen X Collective podcast. We're for men who are navigating midlife with purpose, health, wealth, family, work, and the mark you've made on the world. We're talking about the stuff that really matters with experts who have solutions, advice, and a sense of humor. And now, here's our host, Laurent Truc. Welcome back, everybody. In this episode of the Gen X Collective podcast, we sit down with Dr. Luc Fazio, Chief of Urology at Humber River Hospital and Medical Director at TCBH Healthcare, to dive deep into a topic every Gen X man should be paying attention to: prostate health. As men in our 40s and 50s, it's easy to brush off the subtle health symptoms or delaying regular checkups. But when it comes to your prostate, early awareness can make all the difference. And Dr. Fazio brings decades of experience in diagnosing, treating, and educating men on prostate health. So we're going to talk a little bit about how to screen, life choices that actually matter, and the latest advancements in treatment. So if you're a Gen X man looking to stay healthy, informed, and in control, this episode will be for you. Luc, welcome to the podcast.
Thanks for having me.
Appreciate you taking the time. Would love to start with just a little bit of background. What got you into urology all those years ago?
I always had an interest in surgery. I think when you're starting out, there's sort of two streams in the surgical field and the non-surgical people in medical school. And I gravitated to urology just because of, it initially seems like a fairly narrow field, but it actually has a lot available to it within urology. And I think if you have sort of a technological leaning, there are a lot of avenues to sort of pique your interest. And I think that's what I've gravitated to in my career. So I work a lot with, minimally invasive surgery, robotics, and lasers. And that's kind of been a stepping stone to be able to work with even some novel technologies now in terms of, treating prostate cancer in an increasingly minimally invasive way, and even enlarged prostate. So it really has been a stepping stone into kind of peaking, speaking to my interest that I have in some of these, in applying technology to medicine.
Okay, very good. So urology, there's a lot that it covers.
I think, you can be doing large cancer surgeries. You can be doing microsurgery in the fertility field. Mm-hmm. You can have more of a medical leaning in terms of, men's health and hormonal type therapies. There is a really sort of wide, it casts a wide net, even though, in the end, on first glance, it kind of seems like a fairly narrow topic or narrow field. There really are sort of a lot of avenues within the field to that you can explore.
Let's focus the conversation. We talked a little bit before, and again, there's a lot we can cover. I think prostate health was central to not only what you do, but men of our ages are kind of getting impacted by that quite a bit. So can you talk a little bit about prostate health? Like, why is that such a central topic for men in that age group?
I think, just because the prostate's an inevitability. I think it's not just something if it's an issue for me or not. I mean, I think in some way, shape, or form, we all have to face our prostates at some point in life. So, the prostate just generally gets enlarged as we age. That's a normal process of aging. And it causes some symptoms in some people. It doesn't necessarily cause it in others. But it is, obviously something to be aware of. And prostate cancer is one of the most common cancers in men. It is one of the, leading causes of cancer death in men. And I think that, certainly because prostates are, only things that men deal with, it's easy to kind of sweep it under the rug with. I think that's the general tendency that men have with most of their health issues. Yes. But because it's so prevalent, I think it's sometimes kind of a dangerous combination of ignoring things, and the sort of inevitable, just inevitably having to deal with whether it's an enlarged prostate or issues with prostate cancer. And even if it isn't you personally, your fathers, brothers, friends, it is something that I think impacts all of us eventually somehow.
The men that you talk to, like, how aware are they about what they should be doing? And I mean, you start off by saying we're all going to deal with our prostates at some
Yeah.
point. Do men realize that?
I think everyone's a little bit different, and it's a bit generational as well. Certainly, if I think of my grandfather's generation or
Mhm.
our grandfather's generation, it was really not something you spoke about. You speak to, people all the time say, "Oh yeah, like my father had died of prostate cancer. I didn't know he had it until he died,
Yeah.
until it was very late, or it was not something we spoke about." Or men don't really know their family history because it was never really a topic of conversation. As we get into our generation, it is something that people are aware of. And it really is, I don't know if there's a consistent outlook that people have. I mean, some people are, I think, like our parents' generation and sort of avoiding it. And other
Mhm.
people are much more in tune with just the realities of aging a bit and coming to grips with the fact that you might have symptoms or just have to get checked out. Um, so I think it really spans the gamut, sort of way.
Got it.
But also, part of it is that just raising awareness is something relatively new.
Mhm.
If you compare how men deal with prostate issues compared to how women deal with breast issues, and just the awareness that women have raised with breast health
Yeah.
over the years, and how much more in focus that is, I think,
Mhm.
as opposed to or I think we're probably a decade behind or a generation behind in terms of how we raise awareness with prostate health compared to breast health.
We're talking the other day, and you were telling me how, even the NFL will paint their end zones pink for Breast Cancer Month,
Yeah,
and really nothing gets done around prostate health for
yeah,
men, which
and
is the following month.
they're both during football season. I
They're
mean, you
both
have
there.
October and November, and so there's no reason why you couldn't for men. But no, that's one of the things that's always struck me is that just the NFL goes crazy for and as they should, and I think it's a
Mhm.
great a great way of raising awareness for breast health. But they have a perfect opportunity to follow up the following month, and it's silence. There's
Yeah.
no one painting anything blue, or no one's doing much for it. So that's always kind of been struck me as a bit of a microcosm for just the whole story.
The education as a whole,
Yeah.
yeah, yeah, yeah. If there's one thing at the end of this podcast that you want people, men over 40, to come away with, like, what is it that they should be thinking about?
I think awareness, number one, just also, um, in terms of prostate cancer screening, that's something where there's been a lot of misinformation. Just during my career, if I look at when I started,
Mhm.
I've been in practice not quite 20 years, but close to it. And, um, uh, people prostate cancer was just sort of something where people were probably overscreened when I started out.
Okay.
And then we went through a phase where nobody was, and now we're getting back to a phase where people are again. And that's just amongst the medical community. So there's been a lot of misinformation and back and forth amongst physicians. And I think in the end, the people who have paid the price for that are just men in general, that we haven't had consistent messaging because the medical community, I think that's one of the places we failed actually in the last 20 years. And I think one of the reasons probably we are a generation behind women, for example, in terms of how they deal with breast cancer and breast cancer screening and breast health. So I think that we have an opportunity now to maybe to set the record straight a little bit and just have uh, you know sort of honest conversations about what we should be doing and we should be looking after ourselves.
Mhm.
And I think it starts with just getting yourself checked out, getting screened appropriately. But it's a challenge because you'd likely go to your primary care physician, and they themselves haven't had consistent messaging from the various bodies that should be directing them to what the most appropriate thing is to do. So one of the
Okay.
things I try to do sometimes is have discussions with family doctors or talks with family doctors to uh, talk about, I think, what the best ways of checking for prostate cancer would be, but they've had years of really not getting consistent messaging on what the general practice should be. And I think in the end, it's really fallen on the shoulders of a lot of men, and men are quite happy to say, yeah, I don't need to be checked because, like we really jump at the opportunity to probably ignore ourselves a little bit,
Sure.
just by our nature. So I think that's one of the things that I would say would be a main takeaway I would hope that we develop.
So what is the right age that somebody should start getting screening?
So in general, it's the key ages are between 50 and 70.
Okay.
After age 70, the benefit of screening probably decreases. You can sort of beat prostate cancer just by outliving it, age wise, but 50 to 70 is where there's a real benefit. We would say maybe to start at 45 if you have a family history, like if your father had prostate cancer or brother, or maybe even, like an uncle, or, if you had two uncles or two secondary relatives. And also if you have, if you're at a higher risk because of race. So if you're of an African descent, you probably have a higher risk. And so it would start to say getting checked, around 45 or so.
You're saying parents or dad or brothers. So
if you have
grandfathers less?
less so with the grandfather and sort of, like an uncle or a cousin. I think if you have an accumulation of those people or a combination of them, then certainly it's more of a factor. And then also it's the age. I mean, if your grandfather had prostate cancer and he was 86, it's probably just because he was 86, and it's not because there was a huge genetic predisposition to it. But if your brother gets it when he's 54, or your father had it when he was in his 50s, and it was fairly serious disease, then it is something to get checked out a bit sooner.
And the standard test is the PSA test. Can you walk a little bit through what that is?
So the PSA test is just a chemical that your prostate makes. It stands for prostate specific antigen. So it's relatively specific to the prostate. And as it rises, it increases the likelihood that there could be prostate cancer present. But the tricky thing with it is there's no such thing as really like a normal PSA. And also it can go up for other reasons as well. So if your prostate gland is generally larger as you age, then it will be higher because of that. If you had a urinary tract infection, it could be higher because of that. Sometimes it's just higher and we don't really know why. And it can sometimes be variable. So it is a good, first step. One thing that we have now that has become much more popular and prevalent and available is MRI of the prostate. So for people who have an abnormal PSA, then we can often look at it, the prostate, with an MRI before going straight to doing something invasive like a biopsy, where we're actually taking a sampling of the tissue. So I think we've come a long way with that, and that's just within the last few years that we've had the availability of MRI. And what MRI does really is allows us to, I think, limit the patients who have a biopsy, or be a little bit more selective about going to have something invasive, like, taking a sampling of the prostate tissue. And if we do go do that sampling, that it might be a bit more accurate, because the MRI will pick up areas of the prostate that might be a higher concern for prostate cancer.
And on the MRI, you guys are looking for size, density?
So you do look at the size. The size helps to determine whether or not, a given PSA level might be higher than one would expect. Like you could have a PSA of 5, for example, that is completely normal based on the size of a prostate, or if the prostate's small, a PSA of 5 might be elevated. There can be irregularities that you see in the prostate. You can see a focus of a prostate cancer or a tumor in the prostate on MRI, and you can't really appreciate that with a lot of other imaging tests. And then those areas can be specifically targeted, but we would generally target the whole, prostate at that point, just because the MRI is certainly not perfect, but it certainly helps to increase our accuracy with our screening test, rather than just going on a blood test.
Okay. And then what are some of the early warning signs that you might have prostate problems versus you're getting older and you're going to be more?
So, the challenge with prostate cancer, there really aren't any. It's generally a completely asymptomatic process. I mean, if you're presenting with symptoms of prostate cancer, it's because it's very, very, very advanced. And usually you're presenting with symptoms in other parts of your body because of that it's spread to other areas. So that's where screening really does play a role, because nobody with early prostate cancer is going to come with symptoms. It is something that's completely asymptomatic. And a lot of times when you're having a discussion with someone where they've just had that diagnosis, the common refrain is always, but I feel great. And I'm doing well. I feel as healthy as I've ever been. I feel good. And generally they do, because there's not really anything else to signal somewhere that they're affected by it. Enlargement of the prostate is a completely separate process. It's all happening in the same area, in the same gland, but the prostate gland does generally get enlarged with age. And then usually the main symptoms that are urinary symptoms, like, having a slower flow and getting up at night, going more frequently, sort of more urgently. Those are things that are sometimes easy to ignore because they kind of sneak up on you. And I mean, if the symptoms don't bother you that much, usually it is something that you could just kind of watch. But those are things that I think would generally kind of play a role over time and manifest themselves that way.
There's no easy rule of thumb that if you need to get up 3 or more times in the evening, that's a problem.
No, I mean, I think it's one of those things, you can have sometimes, you could line up 3 people with the exact same symptoms, and one person is completely fine with it, and another person is sort of moderately bothered, and another person wants like a surgery to go and correct it. So it really is a little bit subjective. But sometimes it can be a sign of serious issues, like your bladder's not emptying very well. And, you could be even developing kidney issues because of that. And, so sometimes you get these very subtle signs, and it's at least worth going and being evaluated to make sure, it's just they're just a few symptoms. And if you can live with it, then it's fine. And if not, then there's other things that can be done for it, versus someone where it's a real issue and there's a real underlying problem, even though the symptoms may be relatively mild.
There's a couple of terms. So there's the enlarged prostate, there's BPH, there's prostatitis, prostate cancer. Like, what's the difference between all of them when you get worried?
The symptoms are often inversely proportional to how serious things are. So, the person who has prostatitis, where they have basically an infection or inflammation of the prostate, will be the person who probably has the most symptoms. But quite often that's a temporary condition that would just get better. But some people can have a chronic prostatitis where there's chronic inflammation of the prostate. They'll have, kind of pain when they're sitting, pain that goes through to the rectum, sometimes even pain with ejaculation and sexual activity. So it can be a very frustrating thing for people where it doesn't get better within a couple of weeks with antibiotics and anti-inflammatories. But that's what prostatitis would be, which can occur really at any age, just because it really essentially is an infection of the prostatic tissue, or even just an inflammation of it. BPH and prostatic enlargement are the same thing. They basically just refers to the enlargement of the prostate that occurs as we age. You don't know exactly why it occurs, but I think it occurs to some degree in just about everybody. But there's a vast difference in how big the prostate can get. And it doesn't always correlate with symptoms. You have someone with a larger prostate that doesn't have a lot of urinary symptoms, and someone even with a smaller prostate that has more of them. But it's something that gradually occurs over time. It probably has something to do with various sort of hormone levels and discrepancies between it as we age, and how that changes. That probably gives your body some sort of signal for this to occur. But that is, in general, a natural part of aging, and how much it bothers you and how much it affects you has something to do with how big the prostate gland is, but some of it's luck of the draw as well.
Okay.
And then prostate cancer is cancer of the actual prostate tissue. And that is a separate process. So the prostate being large, having symptoms of enlargement, really don't predispose you or have any relationship to cancer. Cancer is just something that is occurring in the same gland that the enlargement happens to be occurring. But it's a separate thing. Now, it tends to manifests itself around the same time as the enlargement. I mean, those ages of 50 to 70 are when, for the most part, people are going to experience their symptoms with enlargement or prostate cancer. It can fall outside of those ranges as well, but those are sort of uh, I think the sweet spot for when those things are occurring.
Are there lifestyle changes that you can do in your 50 to 70 range to keep your prostate healthier? Is it related to eating, drinking,
There's
things like that?
not, I mean, I think that there were the massive studies done when I started training on things like selenium and lycopene, and there was this search for, the key micronutrient that would be kind of the holy grail for prevention of prostate cancer and prostate issues. And nothing really ever panned out with it. Um, in general, there are, dietary issues. I think that we're finding more and more don't just necessarily relate to prevention of prostate cancer, but prevention of cancers in general. So, avoiding obesity is probably a big one. Obesity is perhaps one of the biggest risk factors for cancers in general that we're finding more and more of. And prostate cancer is no different with that. I think the typical North American high fat, high processed diet likely doesn't really help either. And I think just moving to just a general healthier diet is a benefit. I think it's hard to know these days what a healthy diet is. There's so many different fads. There's so many different ideas about what a healthy diet is. And I don't think that there's any one specific thing that you can key on for prostate cancer. The traditional thinking was, if you looked at men in Japan has a very low rate of prostate cancer. And then men who immigrate from Japan and come to North America within a couple of generations have our risk factors. So probably is something, sort of dietary or environmental. But if you're eating really healthy, or if you are avoiding some of like the meats and fats that you might avoid here, but you're 50 pounds overweight, well, that's a risk factor as well. And there's even some studies to show that if you went on a keto diet, which traditionally we might think is a higher risk for cancers because of the high fat and meat content. Mm-hmm. But if you're obese and you go on a keto diet and you reduce your weight, then that's probably more of a benefit. So yeah, it's hard to follow what is a healthy diet these days,
Sure,
because there's so much contradictory information out there. And so I think just to simplify things, if you can keep the weight off, if you can drop a few pounds, I think that's probably the best way. And if you're and different individuals have different ways of doing that, right? So it's I think that probably just obesity and really extremes of diet, eating a lot of processed food and would be ways of avoiding things like prostate cancer. In terms of urinary issues, that's probably a different story. I mean, I don't think there's nothing you can do dietary to avoid your prostate gland getting larger, but there are some things that can, exacerbate urinary symptoms. So like the intake of caffeine, for example, or alcohol make you go more often. And so many times you speak to people who are getting up at night 3 or 4 times, but
sure.
They're drinking coffee at night or having, wine with dinner. And that's kind of an easy calculation as to why that's occurring. Or just things eating like, spicy food, smoking. Those are things that can sometimes lead to more irritation when you urinate. The biggest thing I find though is just dehydration as well, is that most of us actually it's a simple thing, but most of us don't drink enough water. And so many times you have people coming with symptoms, especially if they have irritative or bothersome urination, they're just dehydrated.
Sure.
So there's a lot of simple things as well. So I think a very simple thing would be just kind of keep some weight off and stay well hydrated, and you're probably ahead of the game if you do just do that.
How do you get men to feel more comfortable about coming in to do the exam? A lot of men just have anxiety. None of us are fans of exams to begin with.
I think I end up seeing the person who's motivated enough to actually come. I think the biggest challenge is probably the people that never come to see me and never get through the door. So I think the biggest issue is probably just going to your family doctor in the first place.
Okay.
And it can be a bit of a challenge because, you know, physicians aren't always super keen on, checking your prostate either or going down that road. Probably rather, take your blood pressure and do those kind of easier things. So it's a situation where I find there's not always a lot of motivation on the medical end either. And
Mhm.
so it is a bit of a challenge. I think you just have to kind of be a bit of an advocate for yourself. And I think it probably just does come from raising awareness. I mean, I think if you're just one individual, kind of going and asking to have your prostate checked or asking about prostate health, it's a bit more of a challenge. But I think that's where um, it's incumbent on us as a community, whether it's the medical community or just men in general, to say, yeah, like this is a thing that we should be doing. And
Yeah.
yeah, it can be embarrassing and it's not anything anyone really wants to talk about. And you might be getting controlled by your wife or partner to come in and do it and all of those type of things. But if there really is a tremendous benefit to doing those things, and in the end, I think you're better off for doing it. I think it's just something that all of us have to work on and just be aware of. But that's why it's good to talk about it
Sure.
and sort of just it's easier to do if you're if everyone you know is doing it or it's just a standard thing and not something where you're on an island by yourself.
And when you say advocate for yourself, so if you're between 50 and 70, how often should you be, if your doctor is not telling you to do it every so often, is it a 2 year, 3 year thing every
So
year?
that's something where, historically it was just something we'd say you do it every year.
Mhm.
But what we're finding is that you don't necessarily have to do it every year. You might only have to go once every 4 years, or you might even get into your 60s. And if your PSA level is low enough, you may not need to do it at all again. And I think that's something where, like the Canadian Urologic Association kind of cut through all the controversy and looked at all the various studies and data that have come out over the last few years that have, resulted in some organizations saying you shouldn't screen ever and others saying you should all the time, and come to a very good compromise where you would look at the initial PSA level, the last PSA level you had, for example, and use that as a basis to what you do and when you do it next.
Mhm.
So do you need to have an MRI now? Do you maybe just need to have a PSA 4 years from now? Can you stop checking your PSA entirely? Those are all, I think, different sort of pathways that you might need to take. But obviously the key is to get checked in the first place.
Sure.
And that's also where I think messaging is important from the urologic community, because we should be the leaders in disseminating information to patients and to, the primary care physicians that are seeing most of the patients and deciding who we see. So, they're the ones that decide who we're going to be seeing, the sort of the gatekeepers for that. And so I think the real key is to, be evaluated, just to get evaluated initially. And then really it's our jobs as physicians to see what the next step would be. But I think there's a lot of good information that even patients can access. Like if you were to Google CUA guidelines for PSA screening, you can look at the same paper I do that I look at if I'm preparing a talk to give to family physicians or that runs my practices, that guides my practice also. And it
Mhm.
basically just has a kind of a stepwise thing of, if you're this age and you do it, the PSA now, or here's if the level is this, you can go on to that. It's a whole kind of decision tree that exists now. And not to say that you need to, immerse yourself in all of these things, but just to be aware in general, you should probably have a PSA at least once. And depending on your age, depending on what that PSA is, it may not even indicate to do it again. But it may most likely there's some sort of next step that you should be taking.
PSA, that's not part of a standard blood test. You have to request that specifically, or?
That's a great question. So, I mean, this is something that also has gone through so much change over the last 20 years. So,
Mhm.
20 years ago, PSA was a standard test that everyone was sort of having done universally. And in all fairness to people who don't believe in PSA testing, it probably was overdone. And at that time, prostate cancer was being overtreated. So there was a real detriment at that point to doing PSAs on everyone because, you know, people everyone was having a PSA. Even low risk prostate cancers were probably being overtreated with radical surgery and radiation. And I think there was a significant harm that had the potential to be done in those situations. So we went from that to then, 10 years ago, PSA being something that nobody ordered, or maybe only urologists would order, but certainly as a screening tool amongst family physicians, it really fell out of favor. And certainly now with that, then we saw the opposite in terms of harm, is that there were more men presenting with prostate cancers that might have been preventable or treatable with surgery or radiation, who would have been appropriately treated if they'd had the opportunity to screen. So we kind of went from one extreme to the other. And I think we're kind of coming back now to the center. I mean, I don't want to use any political references, I guess, but it's sort of like, it's almost like that you kind of go to one extreme, another extreme, and then you see the folly of being too extremist in your thought process. And you come back to that center approach of saying, yeah, you know what? We don't want to overdo PSA screening, but we don't want to throw the baby out with the bathwater, because if we check too many people and are too cavalier about our treatment, we're going to harm people by treating them unnecessarily. And if we don't check everyone, we're going to be seeing a lot of people where we say, well, you know what, if you'd come 2 or 3 years ago, you might have had curable disease instead of disease that's not curable anymore. And we've seen that play out basically, between the early 2000s and now. And now I think there's I think we have a very, sort of a reasonable approach to it, but it's a question of going back now. And I think a lot of physicians would still fall in either camp of, doing PSA as a standard test, like you said, or not doing it at all. Okay. And I think it should be a standard test in some individuals in some circumstances, but it's just sort of selective about, when you do it. But, you might not check a cholesterol level in someone who's 30, but you would definitely do it in someone who's 50. And PSA, I guess, shouldn't really be all that different.
So you talked a little bit about some of the advancements on the screening side. Now they're using MRIs, things like that. How about on the treatment side? Is there any new technology or approaches that's
so
happening?
there's quite a bit new in prostate cancer. So the first sort of new thing is that we are not treating it at all. And I would say that's new, but there's this concept of active surveillance. So for people who have low risk cancer, we know that low risk prostate cancer is very unlikely to ever spread outside the prostate gland, is very unlikely to progress. It's most likely to just sit in your prostate and you live out your life, and it never really causes any issues.
Okay.
And that was one of the things that, again, when I first started training, these are people who would go on to have surgery and radiation. And the surgery and radiation overwhelmingly would have been more toxic to them and caused more harm to them than their cancer ever would have. So, and in Toronto is a center that kind of led the charge globally in just watching these individuals and showing that over years and years and years, it's quite safe to just observe patients and check them regularly to weed out those patients that turn out to have more significant underlying disease. But you can, save thousands and thousands of men who've been diagnosed with prostate cancer from ever having to do anything that they don't need to do. So that would be one sort of avenue. I think in terms of radiation, I'm not a radiation oncologist, but you kind of see the genesis over time that they certainly have different protocols for radiation, where sometimes patients don't have to have so many visits. I mean, the traditional treatment cycle is, 30 or 40 sessions where you go, and now they have sessions where you get, higher doses over shorter periods of time. In terms of surgery, we certainly have robotic surgery that allows us to do, remove prostate through a minimally invasive approach that seems to result in less, complications in certain facets of the disease. And, kind of allows people to sometimes go home the same day that they have their prostate gland out, or the following day, and to really sort of decrease the morbidity of that. I think the most exciting thing is something called focal therapy or, nanoknife. And the idea behind focal therapy is to just treat part of the prostate gland. So, if you do an MRI and you just have a lesion in one specific area, you can actually treat that lesion, by itself and spare all the morbidity and all the complications that can go along with treating the whole gland, which,
Okay.
in surgery can result in erectile dysfunction and loss of urinary control. And with radiation, there's a whole host of issues that can happen with that. Focal therapy is not new. There's been all kinds of different energy sources that have been used to treat these focal lesions. In the past, it has really relied on either delivering very cold temperatures or very high temperatures to the area. But the
Okay.
problem with delivering very cold or very high heat is that the effect on the tissue around it is that you can result in, complications from that. And you have, the rectum sits right behind the prostate, the bladder, the urethra are sitting right around it. It's a very sensitive area. This treatment nanoknife is something that's used in different kinds of tumors. There was some work on pancreatic cancer and other sorts of solid tumors. You can treat it with you can treat prostate cancer with it as well. And we actually did the first prostate cancer treatment in Canada at our clinic a few years ago, with a group of individuals that had sort of gotten together and explored the option. And essentially what you do with nanoknife, the idea of it is you have these probes that you can put around a lesion, and then you run essentially high voltage between the probes. So it's the voltage that destroys the cells in the treatment zone without generating a lot of heat. And I think, we're seeing really great results with very little complications from it, very little impact on sexual function, very little impact on urination, not really anything in the way of rectal injuries or urethral injuries, just because these probes can get very close to these sensitive structures, but because they're not delivering heat and because the treatment area is focused on that one specific area, one specific spot, you are really able to kind of avoid any damage to the sensitive structures. So I think that the concept of focal therapy, and I think specifically the technique of nanoknife, I'm a bit biased because that's the treatment that I've sort of gravitated to in terms of focal therapy, but just the idea that you don't have to treat the entire prostate necessarily. I mean, some patients you do, but there's a lot of patients that are good candidates. And we're finding that more and more as you do more MRI. I mean, we sometimes quite often didn't do MRIs in the past. And, if there was cancer in the prostate, you would remove the prostate if the cancer was bad enough, or you would radiate it. But more and more as our imaging technology improves, our therapeutic technology can now take advantage of that. And I think I think more and more men will be increasingly treated using these kinds of focal type of treatments and focal technologies, just because it really gets away from the stigma of prostate cancer treatment, which is always poor sexual function, poor urinary control, and a host of all other types of things. So I think the future is bright for that.
Okay.
I mean, in terms of prostate cancer that's gone outside of the prostate, there's a host of new medications as well for those patients. I mean, those patients we can't cure, but back when I started training, there weren't many options for those patients, and now there's more and more of them. So the entire therapeutic space has ballooned over the last few years, from patients who just need surveillance to patients who can have a curative treatment to patients who can't have a curative treatment but have a whole host of other sort of options available to them.
So with all these pieces, like has the rate of prostate cancer is that still going up? Because I know it was a massive issue over the last decade. But...
So PSA, the screening test, came along, started to be used in the 90s. And when PSA was first started, there was a massive increase in the rate of prostate cancer because they were detecting all these people that had never been detected before. And then as, it took a few years or maybe about a decade or so to diagnose all those patients. the rate of prostate cancer actually started to decline after that. And specifically, patients presenting with more advanced disease started to decline. But then as PSA screening stopped, I mean, the rate of detection went down, but the rate of people presenting with more advanced disease went up. So we've been on a bit of a yo-yo, and I think I mean, the more you check with PSA, the more incidents there will be. I think the incidents had sort of leveled off as we had a more consistent, PSA screening. But then as that PSA screening dropped off, our detection rate went down, but the patients presenting with more advanced, more significant disease went up. So I think as a population ages, you're going to have an increase, sort of incidence of prostate cancer. I think it's also the kind of prostate cancer that you're detecting. If you're in a population that is screening on a fairly regular basis, you might have a higher incidence of prostate cancer, but you will likely have a lower incidence of patients presenting with more advanced disease.
Sure.
And I think that's what the demographics and the statistics have borne out over the last 10 or 20 years, where we've kind of done an experiment on the population with PSA from 1990 to now, where we used it very liberally, we held back on it, and now we're sort of reintroducing it again.
Anything we didn't cover that you would want Gen X men to know about or think through as they go through these 20 years about their prostates?
I think you can talk about prostates probably endlessly, and people have all kinds of questions and things like that. And but I think the basics are really that everyone's got one, right? So it is not something, if you're having issues with it, it's anything to be embarrassed about. It's one of those things where if you're experiencing it, most likely many, many other people have experienced it. Most likely someone has experienced it. It's just that we tend never to talk about it, in my experience. But I think that certainly there's a million details with prostates and prostate cancers and enlarged prostates, but I think the overarching theme or the overarching goals that we should have would be to just to be aware in general of symptoms you might experience, aware of how you should be taking care of yourself, aware of how you should be getting yourself checked. And I think in that sense, it's fairly, it's relatively basic, but I think the execution in the end is probably sometimes a bit more complicated, but sure. I think that's why we have this discussion and have these sort of groups. And I think the more we do things like this, then the better off we'll all be.
You had mentioned a website or an organization. Like, where do people go to get more information if they're kind of stressed about it?
I mean, I think there's the Canadian Urologic Association is the one that I had mentioned simply because the information that they have on PSA and their guidelines they have for PSA screening are the things that I follow now as a physician. I think knowing what I know of all the different messaging that's occurred with PSA and PSA screening over the last 20 years, it really they've really sort of amalgamated and come up with a very, I think, progressive approach to PSA. And so the CUA the Canadian Urologic Association is a group that I think has a lot of very good information for patients. I don't know. I think if you were to go on I think it's CUA.org, I think there is a patient portal that has a lot of useful information on it. Okay. But just that PSA information, I think if you Googled PSA screening CUA, you would get that sort of documents. If you're wondering what you should be doing or what your physician should be doing, it's all there. And in complete fairness to family physicians, they have been given so much back and forth information, whether it's from their own educational groups and bodies, whether it's from urologists or over the years, that when you sit down and talk to family physicians, they've just been given so much mixed messaging that it's hard for them to know what they should be doing,
Yeah.
what they should be doing for patients, because they have a million other things to worry about. They have
Mhm.
a million other things to check, and we have not done a good job of messaging to our primary care colleagues. And I think in the end, it really is men who have suffered from it, and but one way I think of advocating for yourself would just be to know what that information is, but at the very least, just to go and say, can I be checked,
Yeah.
and just to do the blood test and then take it from there.
And if anything seems weird, typically the doctor will recommend they go talk to somebody like you.
Yeah, and it's just getting yourself in the door.
Yeah.
But
Yeah.
it's that initial step of doing the PSA is where that's a big speed bump. A lot of patients just don't get to that point these
Sure.
days. And again, I can't really fault family physicians for it, because they've just been fed inconsistent information just over the years, and it's, I think, a question of um, again, I think raising awareness and just speaking as a whole about what the most appropriate way of dealing with it is.
Perfect. Luke, thanks so much for taking the time.
No, you're
This
welcome.
is an incredibly important topic, so I'm glad we can share this with the community. And as we talked about, would love to have you on other expertise that you have in future podcasts and part of the group. So thank you for the time. Really
Well, thanks
appreciate
for
it.
having me. I appreciate it.
Awesome. All right. Thanks so much. We'll talk soon.
Thanks.